Conclusion. Interestingly, the focus of research on gaming has been relatively narrow in direction of problematic behavior in combination with gaming. In relation, the developmental side has been more or less neglected by some research groups. But especially experts on gaming behavior are equipped with knowledge and skills that would enhance the development of interventions. The development of interventions is mostly based on cognitive behavioral theories in psychology and psychotherapy. As these theories are based on well-known learning research, the fun aspect of games for health has been identified to be a core aspect for efficiency. To create fun in a virtual environment, a game character of an intervention is the number one option. Good game design is difficult to achieve and not possible for psychologists. Multi-professional teams and respectful interaction in those teams are needed to create an effective intervention with the mentioned fun aspect. In addition, new fields are opening for computer scientists as well as for psychologists. Job opportunities are going to include less traditional positions. Psychologists might grow to be more developers and designers of interventions that are used with only limited help afterwards. Computer scientists might increase their focus on human technique interaction and psychological aspects of technology. Both professions need to develop a sense of interdisciplinary work and different viewpoints of the same phenomenon. Ethical considerations in the development of virtual environments have to be discussed with different professions and the intended target group. Of course, the side effects need to be considered as well, and extensive differential diagnostics in clinical psychology are a prerequisite for participants as long as research was not able to show clear directions in causal relations. A very relevant question that needs to be discussed for the future is the availability of the developed and evaluated interventions. Who is going to be allowed to buy VR interventions? Based on open source ideas and the powerful empowerment aspect of knowledge, free distribution is a very appealing way. A number of problematic thoughts are related with free distribution. Amongst other aspects, the following points have to be considered. A. Subjective value of the system. Some theories suggest that free help is valued less or considered as not effective as help one has to pay for. B. Use for other as the intended purposes. C. Efforts of the developing team and their value system. D. Self-help systems as an option or different modes, well known from self-help guides with supplements for professionals, or the other way round. We state that there is definitely more research needed to draw a clear picture of positive outcomes of games for health. Most studies in this area often included trials with small sample sizes, only a few include large-scale trials. Some studies also lack explicit exclusion criteria as well as the establishment of control groups. Kharrazi and colleagues state that most studies regard a relatively short intervention period, 1.25 months, as well as a lack in theoretical frameworks. The third wave in behavioral psychotherapy, looking at mindfulness, acceptance and commitment as well as compassion, targets all needed prerequisites for personal change, enhancement of well-being, work-life balance and many other concepts that are often present in the media. The fact that Second Life has a huge mindfulness group with people meeting for meditation and the growing number of mindfulness or self-compassion apps for iPhone, Android, iPad and other hardware shows that technology might as well be the cure to an enhanced life. A psychological and psychotherapeutical virtual environment allows us to change our viewpoint and monitor, develop and or optimize our behavioral as well as cognitive patterns. Including assessment functions or psychophysiological measures, the individual possibilities seem never-ending for designing treatment protocols. Playing a game for health means change in the sense of self-actualization as well as in the sense of treating disorders with many additional possibilities real life cannot offer.